Community assessment. The data that need to be collected depend on the objectives of community assessment. In general, the nurse needs to collect data on the three categories of community health determinants: people, place, and social system. The Community Database for Planned Approach to Community Health, PACH, a community health planning model-based quantitative and qualitative data. Since community participation is a premise of the PACH process, the community profile is used to ensure representation of all stakeholders in the building of the PACH community team. In addition to morbidity and mortality data, unique health events are also noted. A unique health event or activity in the community is one that has a short or long-term impact, which may be positive or negative on the health of the community. Behavioral data can help identify the risk factors and the specific population targeted for a particularly activity. Exploring community opinion allows the health workers to appreciate community perceptions of health and quality of life of the community. There are several approaches in conducting community assessment. The nurse utilizes the approach that is most appropriate to the community and the purpose of the assessment. Community diagnosis. A process by which the nurse collects data about the community in order to identify factors which may influence the deaths and illnesses of the population, to formulate a community health nursing diagnosis and develop and implement community health nursing interventions and strategies. Comprehensive community diagnosis aims to obtain general information about the community. The nurse gathers information about the entire community using a systematic process where data is collected regarding all aspects of the community to be able to identify actual and potential health problems according to Moorer and Smith of 2009. Although it requires much time and effort, information gathered through a comprehensive needs assessment will be most useful, particularly when health assessment of a community is being done for the first right time. Periodic assessment and evaluation of health programs may also require the application of this approach. Problem-oriented community diagnosis. Type of assessment responds to a particular need. This focused on a particular aspect of health. In this approach, the nurse collects information with a certain community problem in mind, and then proceeds to gather information from the aggregate vulnerable to the problem. This approach is workable when the nurse is familiar with the community, such as when a comprehensive community assessment has been previously done. For example, the newer learns from a comprehensive assessment that the catchment population has a large proportion of 0 to 5 years old children. Knowing that children of this age are susceptible to malnutrition, the nurse decides to conduct a nutritional assessment, focusing on feeding and dietary patterns of the caregivers of infants and young children. Deciding on a strategy for community assessment depends on the objectives for data gathering, the size and characteristics of the aggregate, and the resources available to the nurse. Collecting primary data. Observation. Rapid observation of the community may be done through an ocular or windshield survey, either by driving or riding a vehicle or walking through it. This gives the nurse the chance to observe people as well as take note of environmental conditions and existing community facilities. When observing the people, the nurse spots for vulnerable groups, the young, the elderly, and pregnant women, for example. The nurse takes notes of the general appearance of the people if they appear healthy, well-nourished, or the opposite. Walking through a community allows the nurse to talk with people to find their perceptions of health and health services. Environmental conditions, like terrain, general condition of homes and housing density, cleanliness, presence of street animals like cats and dogs, can be observed in an ocular or windshield survey. Community resources, such as facilities, barangay halls, schools, places of worship, open spaces like a plaza, and recreational areas like a basketball court are easily discernible. Participant observation is a purposeful observation of formal and informal community activities by sharing, if possible, in the life of the community. This method helps the nurse in determining community values, beliefs, norms, priorities, concerns, and power of influence structures. Examples of formal community activities are barangay assemblies and school, parent-teacher, and church meetings. Informal gatherings take place in a variety of settings in the community, as in sari-sari stores, community recreational areas, or schools. Participant observation is a technique that suits community organizing and participatory action research, which are discussed in Chapter 4 of Nursing Care of the Community by Zenaida Famerksa. Next is survey. Although time-consuming and expensive, a survey may be necessary when there is no available information about the community or specific population group to be studied. A survey is made up of a series of questions for systematic collection of information from a sample of individuals or families in a community and may be written or oral. It is useful when, for example, the nurse needs information about the municipality, but the existing information is about the entire province, or findings from a comprehensive assessment show the need for nutritional assessment of the young children in a particular community. For a comprehensive needs assessment, data are collected about a random sample of the population. Purposive sampling is indicated in a problem-oriented assessment where the sample population consists of the populations susceptible to the problem being studied. In nutritional assessment, for example, families with young children are chosen as sources of information since they are most susceptible to malnutrition. In addition, a survey is also appropriate for determining community attitudes, knowledge, health behaviors, and perceptions of health and health services. It is used by the nurse in identifying patterns of utilization of health services. A survey is also an opportunity for making the members of the community more aware of community problems and their effects and more conscious of their capacity to influence decision-making about health policies and plans, giving them a sense of empowerment. Informant interview are purposeful talks with either key informants or ordinary members of the community. Key informants consist of formal and informal community leaders or persons of position and influence such as leaders in local government, schools, and business. The interview may be structured where the nurse directs the talk based on an interview guide, or it may be unstructured where the informant guides the talk. Used with skill, informant interviews can give the nurse valuable information on community perceptions about health and health care. Community forum is an open meeting of the members of the community. Pulang sa Barangay is a good example of a community forum. It does not only give the nurse information on community perceptions on needs, health, and health care, but it is also an effective tool in providing the people with a medium for expressing their views and developing their capacity to influence decision makers. If initiated by the nurse, the forum is set in coordination with the leaders of the community such as the barangay leaders or other informal leaders. Besides data gathering, the community forum may also be used as a venue for informing the people about secondary data, for data validation, and for getting feedback from the people themselves about previously gathered data. Focus group differs from a community forum in the sense that the focus group is made up of a smaller group, usually 6 to 12 members only. Also, its membership is more homogeneous, that is, persons with similar socio-cultural or health conditions. If used properly, this method is effective in the assessment of health needs of specific groups in the community. A good example is a focus group of first-time pregnant women. Secondary data sources. Registry of Vital Events, Act 3753, Civil Registration Law of Philippines legislature enacted in 1930, established the civil registry system in the Philippines and requires the registration of vital events, such as birth, marriages, and deaths. Health records and reports, as specified by Executive Order No. 352, the Field Health Service Information System is the official recording and reporting system of the Department of Health and is used by the NSCB to generate health statistics. Disease registries is a listing of persons diagnosed with a specific type of disease in a defined population. Census data is a periodic governmental enumeration of the population. Steps: preparatory phase, implementation phase, evaluation phase, preparatory phase, site selection, preparation of the community, statement of the objectives, determine the data to be collected, identify methods and instruments for data collection, finalize sampling design and methods, make a timetable, implementation phase, data collection, data organization/collation, data presentation, data analysis, identification of health problems, prioritization of health problems, Development of a health plan. Validation and feedback. The last phase, and check if the implementation phase is done and achieve for what is being planned. Biostatistics. Demography, study of population size, composition, and spatial distribution as affected by births, deaths and migration. Sources: census, complete enumeration of the population. 2 ways of assigning people. De jure, people were assigned to the place they usually live regardless of where they are at the time of census. De facto, people were assigned to the place where they are physically present at the time of census regardless of their usual place of residence. Components. Population size, this includes the number of the people in the certain location. Population composition. Age distribution. Sex ratio. Population pyramid. Median age, age below which 50% of the population falls and above which 50% of the population falls. The lower the median age, the younger the population, high fertility, high death rates. Age, dependency ratio, used as an index of age-induced economic drain on human resources. Other characteristics. Occupational groups. Economic groups. Educational attainment. Ethnic group. Population distribution. Urban-rural, shows the proportion of people living in urban compared to the rural areas. Crowding index, indicates the ease by which a communicable disease can be transmitted from one host to another susceptible host. Population density, determines congestion of the place. Vital statistics. The application of statistical measures to vital events, births, deaths, and common illnesses, that is utilized to gauge the levels of health, illness, and health services of a community. Refers to the systematic study of vital events such as births, illnesses, marriage, divorce, separation, and deaths. The statistics of disease or morbidity and death or mortality indicate the state of health of the community and the success or failure of health work. The use of vital statistics indices of the health and illness status of a community serves as basis for planning, implementing, monitoring and evaluating community health nursing programs and services. Definitions of terms. Rate shows the relationship between a vital event and those persons exposed to the occurrence of said event, within a given area and during a specified unit of time. It is evident that the person experiencing the event, this is the numerator of the formula MISIT, come from the total population exposed to the risk of same event, which is the denominator of the formula. While rationale used to describe the relationship between two numerical quantities or measures of events without taking particular considerations to the time or place. These quantities need not necessarily represent the same entities, although the unit of measures must be the same for both numerator and denominator of the ratio. Crude or general rates, referred to the total living popular ton, it must be presumed that the total population was exposed to the risk of the occurrence of the event. Specific rate is the relationship for a specific population class or group. It limits the occurrence of the event to the portion of the population definitely exposed to it. See on the next slides the different formulas. Crude birth rate, a measure of one characteristic of the natural growth or increase of a population. Crude death rate is a measure of one mortality from all causes which may result in a decreased population. Infant mortality rate is a measurement of risk of dying during the first year of life. It is a good index of the general health condition of a community since it reflects the changes in the environment and medical condition of a community. Maternal mortality rate measures the risk of dying from causes related to pregnancy, childbirth and puerperium. It is an index of the obstetrical care needed and received by women in a community. Prevalence rate is the measurement of the proportion of the population which exhibits a particular disease at a particular time. His can only be determined following a survey of the population concerned, deals with toll, old and new, number of cases. Incidence rate measures the frequency of occurrence of the phenomenon during a given period of time, and attack rate means a more accurate measure of the risk of exposure. Epidemiology. The study of distribution of disease or physiologic condition among human populations and the factors affecting such distribution. The study of the occurrence and distribution of health conditions such as disease, death, deformities, or disabilities on human populations. Patterns of disease occurrence. Epidemic. A situation when there is a high incidence of new cases of a specific disease in excess of the expected. When the proportion of the susceptible are high compared to the proportion of the immunes. Epidemic potential. An area becomes vulnerable to a disease upsurge due to causal factors such as climatic changes, ecologic changes, or socio-economic changes. Endemic. Habitual presence of a disease in a given geographic location accounting for the low number of both immunes and susceptibles. E.g. Malaria is a disease endemic at Palawan. The causative factor of the disease is constantly available or present to the area. Sporadic. Disease occurs every now and then affecting only a small number of people relative to the total population. Intermittent. Pandemic. Global occurrence of a disease. Steps in epidemiological investigation. Establish fact of presence of epidemic. Verify diagnosis. Do clinical and laboratory studies to confirm the data. Like, is the disease that which is reported to be? Or are all the cases due to the same disease? Another is reporting. Like, is it reasonably complete? Or is it prompt enough so that cases reported to date represent a fairly accurate picture of the present situation? Last, in how to establish fact of presence of epidemic is there an unusual prevalence of the disease, past experience of a given community, relation to nature of disease, or which cases may be considered epidemic and which are endemic. Establishing time and space relationship of the disease includes, are the cases limited to or concentrated in any particular geographical subdivision of the affected community, or the relation of the cases by days of onset of the first known cases may be done by days, weeks, or months. Relations to characteristics of the group of community includes the relation of cases to age, group, sex, color, occupation, school attendance, past immunization, and more. Then relation of sanitary facilities, especially water supply, sewage disposal, general sanitation of homes, relation to animal or insect vectors, relation to milk and food supply, and relation of cases known carriers if any. Correlation of all data includes summarize the data clearly with the aid of such tables and charts which are necessary to give a clear picture of the situation, build the case for the final conclusion carefully utilizing all the evidence available. Establish the source of the epidemic and the manner of the spread, if possible, and lastly make suggestion as to the control, if disease is still present in community, and as to prevention of future outbreaks. Role of the nurse are case finding, health teaching, counseling, follow-up visit. Thank you.